Good afternoon. On behalf of the National Collaborating Center for Indigenous Health, I would like to warmly welcome each of you to today's webinar, At the Interface, Indigenous Health Practitioners and Evidence-Based Practice, with presenters Kim van der Woerd, Sofia Vitalis, and Bernice Downey. I'm going to have Bernice Downey open with a prayer.
Thank you for the opportunity to share this prayer with everyone today. Jimigwich Wikduna, Jimigwich Wiana. We give thanks for things, we give thanks to others. This prayer was shared by Andy Shoza. Today we give thanks for our many blessings. Today we give thanks to the Creator for so much fortune and what we have been given. We give thanks for the sky above and the earth below. We give thanks for the earth we have been offered to be on, and this that we see, the heavens. We give thanks for the rising of the sun and the moon. We give thanks to them. We have been offered the sun and the moon for us to use. We give thanks for the beauty of our surroundings. We give thanks to all things beautiful in this place we have been given. We give thanks for our parents who brought us into this world and taught us about life. Thank you both for this life we are given, Mother and Father. We give thanks for our brothers and sisters who shared our childhood with us. We all thank you today together who were raised here with us, brothers and sisters. We give thanks for our friends who have journeyed along life's path with us. We are thankful for our friends who walked along with us. We give thanks for the laughter of the children. We are thankful for them, the laughter and the happiness our children they have. And we give thanks for the love in our hearts. We all thank you for this love in our hearts that we have. We give thanks for all of those healthcare practitioners, essential service workers, emergency workers who are out there today helping to keep things as stable as they can in this ever-changing environment. And we offer our prayers to those who have passed on to the spirit world during this crisis and for their families that they leave behind. Chimigwich, thank you.
Thank you, Bernice, for sharing that. It helps center us as we do a webinar in the face of a devastating pandemic that we're looking at right now. So my name is Roberta Stout, and I will be facilitating today's webinar. I'm one of the research associates here at the National Collaborating Center for Indigenous Health, which for those of you who may not know is located at the University of Northern British Columbia in Prince George, BC, in the traditional territory of the Lheidli First Nation. Very briefly, the 6 national collaborating centers were established in 2005 with funding from the Public Health Agency of Canada, with a focus on areas including infectious diseases, environmental health, healthy public policy, determinants of health, and methods and tools for knowledge translation. The NCCIH is unique amongst the NCCs in that we have a specific focus on the health of a population, with the goal of supporting health equity for First Nations, Inuit, and Métis peoples. So before I turn over to our esteemed presenters today, I would like to share their abbreviated bios with you. However, their full bios will be posted online with the webinar recording. Dr. Kim van der Woerd is a member of the Namgis First Nation from Alert Bay, BC. She's the owner of Reciprocal Consulting, an Indigenous consulting firm specializing in program evaluation and research. She completed her PhD in psychology at the Simon Fraser University and has received numerous awards for her research and business. Sofia Vitalis has Indigenous and Mestizo roots from Colombia, South America. She has a Bachelor of Arts from the Simon Fraser University and has worked with Indigenous peoples in BC and internationally, and works with Reciprocal Consulting alongside Dr. van der Woerd. Dr. Bernice Downey is of Ojibwe and Celtic heritage. a medical anthropologist. Her research interests span health, health literacy, and Indigenous traditional knowledge, and health research system reform for Indigenous populations. She is currently cross-appointed to the School of Nursing and Department of Psychiatry and Behavioral Neurosciences, and is the Indigenous Health Lead for the Faculty of Health Sciences at McMaster University. She is also the Acting Director of the McMaster Indigenous Research Institute. So with no further ado, I will turn this over to Dr. Kim Woerd and Sofia Vitalis for their presentation.